afternoon, doctors. Thank you for attending our breakout session, session 5, the human perfume. Our session chair for this afternoon is Dr. Vanessa Kathleen, Caingugh, MD, FTP Life, and FPSC. She's the head of the section of psychiatry of the SLNC Global City. She is a training officer with the Department of Psychiatry of the Medical City. She is the co-leader of the Special Interest Group of the World Psychiatric Association Psychotherapy for Youth. She is the past president of the Philippine Psychiatric Association, the immediate past president of the Philippine Society for Child and Adolescent Psychiatry, and immediate past chair for the Department of Psychiatry at St. Luke's Medical City Medical Center Global City. So, please help me in welcoming Dr. Caingugh.
My class, can you hear Mr. Bass? Okay. Good afternoon. I will be your moderator for this session on the human birth theory. Welcome to this session, which is a compelling exploration into the underlying dynamics of mental illness, as proposed by Massimo Fagioli in 1971. Our aim today is to delve into the concept of the annulment function, a non-conscious dynamic that causes the disappearance of the object of a relationship, not through mere forgetfulness, but through a profound loss of emotional connection and affectivity. This session will illuminate how significant relationships can seemingly vanish from one's psyche and the result psychological impacts such as emotional disbalance after a loved one's death. Our distinguished presenters will guide us through contemporary research and interdisciplinary insights, revealing how understanding this dynamic within a therapeutic context can recover lost affections and foster more valued relationships. Organized by the Massimo Fagioli Foundation, this symposium promises to enrich our understanding and provide practical strategies for integrating these insights into therapeutic work. Now it is my great pleasure to introduce our esteemed presenters. We have three. Our first presenter is a psychiatrist, individual and group psychotherapist, and developmental psychologist. He is a consultant at the Child and Adolescent Mental Health Service in Florence and co-leader of the Special Interest Group on Psychotherapy for Youth Mental Health within the World Psychiatric Association's Psychotherapy section. He is currently pursuing a PhD in neurosciences at the University of Turin, focusing on body image disturbances. His work is grounded in the human birth theory by Massimo Fagioli, with whom he trained for nearly 3 decades. As a teacher at Biopsychosocial School of Psychodynamic Psychotherapy and previously at the University of Rome, Sapienza, he has shared his expertise widely. He has held key positions in hospitals across Italy, including head of the Service for Youth Mental Health and head of the Service for Early Diagnosis and Treatment of Eating Disorders. He has authored numerous publications on psychopathology, psychotherapy of the developmental age, psychosis, and body image disorders, as well as several books, including Anorexia, Eating Disorders, and Dysmorphophobia. He also edited the new edition of Interpretation of Schizophrenia by Silvano Ariel. To give us a presentation on the interpretation of annulment pulsion as a basis for treatment in psychotherapy is Dr. Luca Giorgini. Let me also introduce the rest of the speakers. The next presenter works in the public health system and holds a position in public health. In addition to her public health duties, she maintains a private practice in Florence specializing in individual and group psychotherapy at Santa Maria Nuova Hospital and its outpatient clinic in the town center. She also serves as a psychiatrist at the National Health Service in Florence, Santa Maria Nuova Hospital. To present the psychodynamic psychotherapy of borderline personality disorder, a multi-professional approach, according to the human birth theory, is Dr. Martina Moneglia. The other presenter is a renowned child neuropsychiatrist at St. Andrea University Hospital. She holds a PhD in neurosensory plasticity from the Department of Neuroscience, Mental Health, and Sensory Organs at Sapienza University of Rome. With advanced training in the first 1,000 days of life and psychopathology, from childhood to adulthood, from Sapienza, she brings a wealth of knowledge and expertise to her practice. She is also a professor in the residence program in psychiatry and gynecology and obstetrics at the University of Naples, Federico II, Italy, and a visiting professor at Univar University of Neva, Colombia. Her contributions to the field are further highlighted by her roles as a scientific council member of the World Federation for Psychotherapy and a trustee of the American Academy of Psychodynamic Psychiatry and Psychoanalysis. To present on the human birth theory and neurobiological findings, evidence on the principle of equality between humans as basis for the curability in psychotherapy for a better society is Dr. Daniela Polese. Then, another presenter is an MD psychiatrist, an individual and group psychotherapist currently serving in the mental health public service at ASL Roma 3 in Rome. He holds a PhD in neuroscience from Tor Vergata University of Rome and is specialized and trained in psychiatry. He has shared his expertise as a speaker at the AAPDPA 63rd annual meeting in San Francisco, California. With extensive psychotherapy training through Massimo Fagioli's collective analysis seminars since 1990, he brings a wealth of experience and knowledge to our sessions. To deliver his presentation entitled From the Loss of Common Sense to the Disappearance Fantasy, Psychopathological Implications in Psychosis Treatment, according to the human birth theory, is Dr. Alessandro Mazzetta. Following the presentations, after the presenters have said their talks, we will be joined by a distinguished discussant to provide his synthesis. Our discussant is psychiatrist at the Makati Medical Center. He just delivered the presidential lecture earlier. He is a member of the training committee in the Department of Psychiatry and a secretary of the Specialty Board of the Philippine Psychiatry. He is also a council member of the Asian Federation of Psychiatric Associations. His past roles include serving as past president of the Philippine Psychiatric Association and president of the Carl Jung Circle Center and secretary for the education and training of the ASPA. Our discussant for this session is Dr. Rene Samaniego. Without further ado, let us hear the first presenter, Dr. Luca.
Good morning, good afternoon, everyone. Thank you, Vanessa. Thank you for your kind words and for being here to chair this symposium. I'm thrilled to be here again after 5 years, and I would like to special thanks to the organizer, particularly Menez and della, and to Massimo Fagioli Foundation for supporting our symposium. Our symposium explores Massimo Fagioli's human birth theory, which describes the physiological origin of the human thought emerging at birth in response to life. This initial thought is unconscious and imaginative, not rational. While the next presentation will delve deeper, I will focus on the pathogenesis of mental illness and psychotherapeutic treatment. According to human birth theory, illness is a consequence of the loss of the original physiological state we are all born with. This occurs during the child's development due to disappointing relationships where emotional requirements, such as love and attention, are inadequately fulfilled, even if physical needs are met. A child requires a complete response to their emotional requirements. Adults, however, may fail to provide these, not out of malice, but due they cannot live to a lack of affectivity. This deficit, often rooted in their own experiences, means that even though they ensure the child lacks nothing, they are unable to understand the child fully. In such cases, the caregiver-child relationship becomes violent, not physically, but psychologically, due to its disappointing nature. This violence is invisible because it's tied, because it is tied to an absence, a lack of affection. The sensitive child perceives this void and reacts. Unable to feel physically, they escape mentally. The child enacts what is known as the nella impulsion, an unconscious dynamic in which the other person and the relationship with them are made to disappear, rendered non-evident in the mind, as if they had never existed. This is the fundamental psychopathological dynamic. Disappointed by the unmet desire to be loved, the child erases the painful situation. In doing so, they eliminate the pain and disappointment, but also diminish their capacity to feel and react, their vitality. It is as if they close their eyes, turn away, or blind themselves to avoid suffering. Repetition of this creates growing void, a loss of affection, potentially leading to a complete absence of affect. This differs from indifference, which is a mere disinterest in something, such as astrology. The absence of affect pertains to the relationship with human reality, not things. The child loses the ability to feel and clearly distinguish the quality of a relationship, to differentiate who loves or hates them, positive from destructive relationships. As adults, they may even prefer the lover, where the dynamic tends to repeat itself, disappointed by the other and unwilling attachment, becoming increasingly confused about the reality of others and themselves. They become less and less capable of emotional feeling, increasingly non-affective, or filled with hatred and anger for having been castrated due to the loss of their original health. Key points. First, the nulla impulsion occurs when the disappointment experienced by the child in the relationship exceeds their resilience, their vitality's resources, that is, their capacity to feel and react to stimuli. Second, illness is not the parents' fault, as they usually try their best. Parents themselves may have had disappointing relationships that undermined their emotional abilities making them unable to adequately meet their child's requirements. What matters, therefore, is the specific relationship between that caregiver and that child. To better illustrate the concept of non-impulsion, I thought it might be helpful to turn to artistic representation. Anish Kapoor explores the concept of black through the use of an innovative material made of carbon nanotubes called Vanda Black, capable of absorbing over 99.96% of visible light, resulting in objects losing their contours. The third dimension disappears. In painting, in the painting shown in this slide, called non-object black, a black sphere simply vanishes against a similar colored background. It is there, but cannot be seen. To see it, one must change their perspective. Similarly, annulment makes the other and the content of the relationship disappear. But of course, this happens only in the unconscious mind of the person who enacted the annulment, not reality. Closing one eye does not truly extinguish the light in the room. In terms of psychic dynamics, closing one eye means losing sensitivity, affectivity, such that the person does not realize what they have done. Another person's intervention is necessary to reveal what has happened. If I see a friend with a beautiful girlfriend and then at night dream that she was ugly and poorly dressed, I might realize that I have an issue, perhaps envy. In this case, we speak of negation, which in human birth theory refers to an unconscious dynamic of devaluing the other and the relationship. Negation is an unconscious dynamic that one may notice on their own to some extent. Annulment, on the other hand, is different because it entails the complete disappearance of the disturbing object, making the person no longer feel bad or aware of the problem. They lose their ability to emotionally see and feel the profound reality, leading to an almost complete affective absence. The unconscious world, made of affection, emotion, and images, seems on the verge of succumbing and disappearing entirely, like the dog in this painting by Goya, leaving space for the void that occupies almost the entire canvas. A person without affection, a sort of robot, may lead to an apparently normal life. They do not feel bad, but their lack of affect can harm those around them. An example of the dynamic of annulment occurs when a patient says that they didn't feel pain after the death of a loved person. They may acknowledge the event intellectually, but in reality, they didn't feel pain because they simply didn't feel anything. Since the annulment pulsion is an unconscious dynamic, treating it requires addressing the unconscious reality. A preferential way to do this is through the interpretation of dreams. Dreams are a form of thought, a thinking images, and often speak more directly about what's truly affected or troubles us. A dream is not an unconscious, a conscious memory, the reproduction of conscious reality, because the image is transformed by the mental reality of the dreamer. Understanding the dreams requires knowing their language, which, unlike verbal language, is expressed through images rather than words. There is no time to explain in detail the interpretation of dreams according to human birth theory, but I can offer a simple example. A patient might dream of sitting in front of an empty chair. Consciously, the patient knows that the therapist is in front of them, but at the same time, dream suggests that the therapist is not there. The patient is saying that the therapist is absent, even when present. That means they are uninterested, not truly listening. If the patient were right, the therapist could not provide any help, and the therapy would not be possible. Instead, if the therapist is sure that they have always been emotionally present, they can reveal what the dream does not openly state. The chair is empty because, not because the therapist is emotionally absent, but because the patient has made the therapist disappear. It is the patient who has annulled the relationship with the therapist after the session has ended, and as if it had never been there. The patient has learned to react with an impulsion to all stimuli that differ positively or negatively from the familiar, and does the same in the relationship with the therapist. To notice that, tragically, they will not only annul violent and disappointing stimuli, but also those people that fill them with interest because they are perceived as new and therefore dangerous to an equilibrium based on annulment and lack of affect. To heal the illness, the psychotherapist must offer a non-disappointing relationship and seek to understand the unconscious thought. In this way, the patient can discover that their illness is tied to the loss of a previous state of health, a symptom of a disease, and not an existential condition inherent to human nature. The psychotherapist must point out time and again how the annular impulsion alters the patient's ability to relate to others. Even in the relationship with the psychotherapist, the patient will tend to enact the same pathological dynamics, annulling them and relating to them as if they were someone else, like the father or mother who disappointed them. The therapist cannot passively accept this, but must interpret annulment and on their own image and mental qualities, their interest, affectivity, intelligence, etc. The constant and systematic frustration of annular impulsion, facing the patient's omnipotent ability to make the other human being disappear, will eventually lead to the appearance of vitality and affectivity. The patient will increasingly become capable of extinguishing their own relationship with others, based on affection and emotions. They will better be able to navigate their personal relationship to withstand the disappointments they may encounter in interpersonal relationship without annulling them. Okay. Vitality will gradually grow and merge with fantasy to make it disappear, not others, but the patient's internal pathological dynamics, including their compulsion to repeat. A disappearance fantasy directed against their pathological dynamics will, once achieved, allow the recreation of the original state of health we are all born with. Thank you.
Thank you, Dr. Giorgini. We will now move on to our second presenter. I now call Dr. Daniela Polese.
Good afternoon. Thank you, everybody, to be here with us. I would like to thank you, the President Cesar Alfonso of the WFP and Secretariat Alma Jimenez for having invited us here. And I would like also to thank the Philippine Psychiatric Association for all this wonderful conference and the work that they are doing here. It's very, very interesting, and it's an honor to be here. We're going to speak about the human birth theory and the principle of equality, but we would like also to find out the neurobiological findings which correlates with human birth theory. As we all know, the WHO defines health not simply as the absence of disease, but as a complete physical, mental, and social well-being. It is a right for all human beings, regardless of age, gender, ethnic, cultural, social, or economic background. In the 2024 WHO guidelines for mental health, cognitive behavioral therapy has been recommended for both adolescents and adults instead of psychodynamic therapy. This led to a debate in the Lancet Psychiatry among a group of colleagues, very interesting, who argued that psychodynamic therapy is also evidence-based, particularly for conditions like depression, anxiety, self-harm, and suicide, including also somatic disorder, eating disorder, post-traumatic stress disorder, substance-related disorder of character abuse and addiction, and treatment of children and adolescents with depression. But the WHO group of colleagues response followed, emphasizing that, as we also have said before, on average, only 2% of global health budgets are allocated to mental health, and that 82% of people experiencing mental health disorders live in low-income and middle-income countries. Effective yet scalable mental health care is urgently needed. The organization suggested a second therapy, interpersonal therapy, which is easier to administer and can be conducted in groups and guarantee health equity, equality, non-discrimination, feasibility, and human rights and social cultural acceptability. The Uganda clinical trial by Professor Mpugu, that is here, serves as an example. The human birth theory clinical application consists exactly in a psychodynamic group psychotherapy, which matches the group psychotherapy and the psychodynamic psychotherapy, focusing on the original neurobiological equality between human beings. In public healthcare settings, this approach allows for the treatment of 315 patients simultaneously with a single therapist. In private practice, it ensures equal costs for all attendees, generally low, I can say. This is a paper just published on psychodynamic psychiatry, and it's explained human birth theory a little bit. The theory is based on three key innovations, mainly. First, the concept of a healthy newborn's mind functioning in relation to the environment immediately at birth, before breastfeeding, particularly through a brain reaction to light. Second, the resulting idea of the unconscious functioning as coherent, affective, and intelligent, reacting to the environment and not aggressive, pervert, or chaotic, as it's said by the traditional concept of unconscious in psychoanalysis. And human birth theory conceives a mind physiology, pathophysiology, and therapy aimed at restoring the original mind physiology through the therapeutic relationship, as the mind got sick in early relationships. Given this new concept of unconscious, the group is not no more dangerous, is no more conceived as a chaotic place, but a place, on the contrary, of inclusivity, and is accessible to everyone, no matter the origin, social, cultural, ethnical, etc. Finally, another novelty of this theory consists in the neurobiological basis of this mind functioning from birth, before breastfeeding, as I said. The author, Massimo Fagioli, suggested that the brain reacts to the extrauterine environment, specifically light, with a consequential light-triggered brain activation, which shapes the mind. The mind functions through the non-impulsion against the inanimate non-human external world, that is light, making it not existent. And at the same time, thanks to the newborn's vitality, which is usually measured by the Apgar score, this annulment pulsion is accompanied by the creation of an image of brightness and warmth, and it is neurologically based on the tactile memory from the skin's previous contact with the amniotic fluid during the fetal period. These dynamics constitute the so-called disappearance fantasy. We mentioned this in the paper with the group of Lille in France. So neurobiological and neurofunctional data are recently beginning to emerge in literature, highlighting the validity of this theory. Firstly, at 24 weeks of gestation, the fetus reaches viability and can be born with an increasing probability of survival and well-being. This stage coincides with the formation of thalamocortical circuits, including the visual and non-visual networks. Before 24 weeks of gestation, brain development was completely experience independent, and as you can see by this paper, which was published in 2024. While from this point, and during the last trimester, you can see the first part, the upper part, during the last trimester, it has been reported that the fetal brain becomes sensory sensitive and experience expectant. This may correlate with the trace on the skin from the previous contact with the amniotic fluid, which a newborn has at birth as the sensory sensitive is activated, and which, together with the brain reaction to light, is crucial to realize the disappearing fantasy dynamics. However, during the fetal stage, all neuronal function is unique. We have to imagine that fetus brain is not the newborn brain, also during the third trimester. More and more data have been publishing about it. In particular, in the fetus, the GABA has an excitatory functioning, while at birth and throughout all life, so birth is like throughout life, GABA has an inhibitory functioning, switching its function around birth. This is compatible with the modulation of reaction to the overstimulating external world at birth, in contrast with the brightness inside the womb. So GABA is crucial to protect the newborn at birth. The EEG data show a difference between the fetus and newborn, since the first fetus has spontaneous activity transients, which represent the main activity and the independent development and growing of brain network. While here they're examining the early preterm newborns, preterm and newborn in the full term, and towards the full-term age, the SADs, the spontaneous activity transients, change primarily in their overall waveform and interhemispheric synchrony. You can see the two hemispheric have different colors. There is a robust increase in the amount of ongoing cortical activity that is in the middle between the SADs. The brain change at birth seems to be fundamental for triggering first breath. The clearance of pulmonary fluids occurs within seconds, only seconds, and does not appear to be explained by chemical phenomena, because they would take several minutes instead. So, it is reported that what allows the lungs to clear and to prepare for the first breath is a sudden, powerful contraction of the diaphragm, enabling them to make their greatest respiratory effort, which is the first breath. Data has shown an immediate neurogenic drive, where the inhibition of the colic fusion nucleus is lifted, allowing the brain to instantly transmit the signal to the muscles, the respiratory muscles. But we can ask ourselves, what triggers this cerebral drive in mere seconds, around 20 seconds? We have published this paper in order to debate it, as the impact of the extraluterine environment has recently been highlighted by some researchers. Alice Prue and colleagues highlighted how preterm newborns' brain present an acceleration of their maturation right after birth, becoming closer to the newborns of the same age instead than the fetus of the same conceptional age, due to the external environment. Schmidt-Melado's group has shown that the impact of the extrauterine environment is so strong that preterm brain is helped to recover by this impact. However, the extrauterine environment is full of stimuli. According to the human birth theory, light is the only stimulus absent in the womb, and it could explain this immediate activation of the new brain functions. In the last 2 decades, research has shown the existence of a non-visual system. This is a system melanopsin independent, and it is made of the intrinsically photosensitive retinal ganglion cells that you can see on the slide, iPRGGs. These cells are very efficient and functioning at birth, in contrast with the cones and rod cell of the visual system. When Ellen Cernigor is called to comment this discovery, she writes, paradoxically, second sight comes first. That was very, very interesting because newborns are still not these cells seems to function in connection with an alignment with the circadian rhythms, okay? But however, newborns are still not aligned with circadian rhythm. They don't even produce melatonin. So this full functioning at birth is poorly explicable. In addition, researchers have hypothesized a specific birth-triggered functioning, but it has still not qualified. Then, our hypothesis is that iPRGGs mediate the newborn's brain reaction to light at birth. This is a paper that we have done with Sapienza Group at university, and is supported by the PhD program in neurosensory plasticity. And we have reviewed and hypothesized this. iPRGGs are only around 1% of retinal ganglion cells, and they are photoreceptors and have the capability to neurotransmit to photons signal very fast. Are localized in the inner retinal layer, right behind the pupil, so these cells are the first capable to catch photons at birth. In addition, in the last years, research on brain and their axon are widespread on brain. So their signal transmission could be a correlation with the immediate neurotransmission of light to the whole brain in order to get a brain reaction and activation. But it is not proved yet so far. But in the last year, research on brain functional connectivity with fMRI has observed several differences between fetuses and newborns. However, the studies worked separately on fetuses and newborns. So there was some difference, but what we needed was a study which followed the progress of brain development from the prenatal stage to the newborns. For the first time, a study by the group of Moriah Thomason, which has been published in last November 2024, focused precisely on the birth transition, showing the progressive changes of resting state functional connectivity during time, from 25 to 55 conceptional weeks. It means that they follow with the change from the fetal stage right after the 24-week of gestation, when the fetus becomes viable, until the newborn. They have clearly demonstrated a birth-driven rapid surge in the functional connectivity on a global scale in the human newborn brain, probably reflecting neural processes that support the brain's transition to the external world. They found a sudden and impressive increase of functional connectivity exactly at birth. You can see here. They were very impressed by this because it's all around birth. This will be in line with the newborn's reaction to the new richly stimulated environment, in our opinion, particularly bright energy. This increase of connectivity was finally particularly intense in the subcortical network and in the superior frontal network. suggesting how the newborn brain may already be featured by superior functioning, mind activity, the frontal network, in correlation with the realization of a mind formation at birth, according to the Jungian theory. In conclusion, this theoretical formulation underscores that all human beings share an equal neurobiological origin and mental qualities, providing further biological evidence of equalities and equal rights for all from birth. Moreover, it's perfectly coherent with its clinical application, that is the group psychotherapy, which is feasible, affordable, and inclusive. Thank you very much.
Thank you, Dr. Cruz. We'll now move to our third presenter, Dr. Martina Moneglia.
Okay, can you hear me? So thank you and good afternoon to the audience. And let's start with my presentation on borderline personality disorder. This is an overview of my presentation. And first of all, borderline personality disorder prevalence in general population is from 0.2 to 1.8%, and increase in outpatient from 8 to 11%. But in hospitalized patients is from 14 to 20%. The concept of borderline starts during the last century, in 19th century also, and psychoanalysis debates the treatability of these patients, and as some clinicians embrace the term borderline, others maintain the idea of a schizophrenic nucleus. Later on, three authors are very important in the definition and the dissemination of the term borderline. Stern, Knight, and Grinker in the 30s, the 50s, and the 60s. But then in the 70s, Caingugh starts studying the disorder as a personality disorder, and he specifically thinks that borderline disease have a particularly intense innate aggression combined with a traumatic environment, and that could lead to splitting, projective identification, and identity dispersion. Now, I don't want to speak about the DSM-5 that we all know well, but I want to underline some core features of this disorder. As we all know, in this disorder there are fear of abandonment, separation, and rejection, and that can lead to significant alteration in self-image, mood, and behavior, but also a profound sense of emptiness that can lead to the patient to rely on heavily on others for validation, to feel alive, and to define themselves. There is also brief separation are experienced as dramatically and unbearably painful that could lead to symptoms like explosive rage, violence, impulsivity, and also chaotic relationship oscillating through emotional extreme of idealization and evaluation. Though that can lead to an inability to control impulses, intense mood swing, suicidal thought or attempt, and self-harming action. So, as with DSM-5, we have a clinical description. I want to underline and remember the diagnostic psychodynamic manual, especially the PDM-2, that could give to clinicians the possibility to give a diagnosis and a therapeutic hypothesis route with psychodynamic model and theories. And the authors think that early interaction between child and caregiver, especially in attachment pattern, can lead to the disorder, especially for borderline, is a disorganized pattern during early childhood that can lay the ground for potential development of the disorder later in life. But now, let's try to understand how in Italy work the mental health. So in Italy, we have an NHS and a mental care department exists. This department is divided in adult mental health, addiction service, child and adolescent neuropsychiatry. So a patient with borderline personality disorder is followed by this department. First of all, as we all know, this disturb can be an emergency. So sometimes the patient needs an hospitalization for an acute episode. But because we can have suicide range from 5 to 10%. But also, there is not only the emergency, but all the care of this patient that have to be done in a patient setting. So first of all, we need to do a psychiatric evaluation to confirm the diagnosis, and the group will give the patient an integrated therapeutic and rehabilitation treatment plan. This plan is led by a multidisciplinary team made of a psychiatrist, psychologist, nurse, nursing assistant, educator, social worker, and support administrator. All this group is really important for the patient because can help in the acute episode, but also can cure comorbidities, substance abuse, and also help in social economic needs and rehabilitative support. In our department in mental health in Italy, healthcare can be provided of an intense ABM training in dialectical behavioral therapy. DBT offers a concrete tool for managing the most dangerous suicidal crisis. And this method thinks that the role of chaotic emotional relationship with caregiver linked with psycho-functional care alternating with periods of abandon and isolation are important in the origin of the disturb. But this method primarily focuses on managing explosive or dysfunctional symptoms within adolescent and adult interpersonal relationship. Now, we know that NICE guidelines think and say that psychotherapy is the gold standard for BPD. But we know also that to help patients with borderline, we don't have only to be concentrated in acute crisis-driven behavior, but we need to treat deeper and non-conscious pathological dimension of this disorder. It's for that reason that we want to provide to this audience, and we want to try to explain how psychotherapy based on Professor Massimo Fagioli, human birth theory, HBT, can help this kind of patient. This theory and this method can allow patients to recreate the image of a concrete, valid human relationship rather than a disappointing and unsuccessful one. As my colleague already explained, I want to explain for a few moments the physiology of the human birth. In that instinct and knowledge, Massimo Fagioli theorized the dynamic of human birth as the origin of psychic life. Through contact with amniotic fluid on its skin, the fetus develops vitality, its first biological response to external physical stimulation. And the union of light with the biological reality of the retina cerebral substance marks the emergence of psychic life at birth. At this moment, the infant forms its first mental image and experiences a global bodily reaction, the annulment pulsion, to the new stimulus of life and fantasize, making the newly formed self disappear as returning to the womb. Fagioli termed this fusion of annulment pulsion plus vitality the disappearance fantasy. And through this formation of the initial internal self-image that the infant will seek human connection, the hope certainty that another human being, breast, exists. So, contrary to Caingugh view, the infant is not innately aggressive, but through the hope certainty that the breast exists, the infant invests in libidinal energy in the mother. If she is emotionally present, she confirms this intuition. In addition to physical nourishment, breastfeeding transmits the psychological quality necessary for psychological development. And the action of sucking and seeing become fused. Eyes and mouth are integrated in what Fagioli termed the eye-mouth triangle. So the libido, integrated with eyes, become invested in the quality of the object. These enable the infant to tolerate separation and develop a growing interest in the mother's psychological attributes, facilitating the weaning process. The mother is not merely the breast that nourishes, but the mother who smiles, who speaks. If in the meanwhile the child has achieved full integration of eyes, ears, mouth, skin smell, will not be able to make the breast disappear as a total elimination of the object without realizing an image, internal image of it. But if the mother failed to confirm the infant of certainty, whether due to her own emotional or affective deficiency or for the presence of abusive circumstances, it is this failure rather than an innate flow that fosters the potential for ambivalence and aggression. Infants are born psychologically sound and without inner flow. The human tragedy does not lie in birth, but in weaning when the child rejects, annulling the frustrating breast. So, the newborn rejects physical milk while remaining psychically blind. When the external object is disappointing, the infant develops the annulment pulsion. These led to a disconnection from the vitality of the body, and an inner state of disappointment and emptiness is then projected onto the mother, projective identification. Now she's experienced as sadistic and disinterested, and that creates a sadomasochistic dynamic where the infant seeks the mother but experiences the relationship with anguish. So, continuous libidinal impoverishment prevents the infant from integrating the eye-mouth triangle, leading him to experience separation as emptiness. Libido remains threatened to greed, physical and oral gratification. The relationship with reality is not characterized so by a dynamic of investment, separation, and image formation by blind projection, annulment, and inner void. If the breast disappears at weaning, the first great void is realized, the first nucleus of anguish. So in adulthood, patients with BPD are unable to create an internal image of the relationship experienced at each separation, and the patient is left with a sense of emptiness and a tendency to engage in sadomasochistic dynamic to fill the void. The other is seen as a savior, capable of filling the emotional void, and the patient reacts to any change with the other in the relationship with blindness, anger, and introjection. That which is seen and heard will be annulled. What is loved will be sucked and beaten. So projection and distortion of the other image follow, becoming the executioner, a source of disappointment and ruin. So in adult relationship, the patient can oscillate irremediably between idealization and evaluation. When severely impaired by projective identification, patient ability to see reality is distorted. Both non-conscious thought and feeling, along with conscious perception of reality, are affected. This can manifest as behavior that endanger the body with temporary paranoid thoughts or dissociative episodes. But, as we said in the first slide, some clinicians in last century remain with an idea of schizophrenic nucleus, and we want to do a differential diagnosis with schizophrenia, because the schizophrenic experience transcends the sadomasochistic dynamic, moving beyond the realm of pleasure and pain, hatred and anger, while the borderline patient remains entangled with this kind of experience, even at the risk of self-harm. So, the role of the psychotherapy is first of all to establish a differential diagnosis, and then to frustrate the pathological dynamic, interpreting pulsional reality that emerges through dreams and narrative, confronting and transforming it. This is what we propose to the patient who come to analysis. We provide interpretation, a term that encompasses the analysis, humanity, attention, memory, understanding, speaking, explaining, and caring for the patient. That is, we offer the quality of the external object. So, the patient in individual psychotherapy can develop a non-annulling relationship with the one that is capable of understanding and revealing internal quality through interpretation. As the patient increasingly sees and integrates this recreated quality, blindness and greed diminish, fostering a renewed interest in others. Once the patient has rediscovered the ability to understand their internal reality and develop an interest in others, group therapy can be proposed. Group therapy in borderline patients is crucial and evolutionary transition, but requires a cautious approach, because patients must have undergone sufficient change to recognize that people are neither disappointing nor perfect. Develop also the ability to see, hear, and understand others as they are in reality, without projecting their own expectation upon them. So in conclusion, through a therapeutic approach based on ADHD, the borderline patient can develop a new self-image and establish a solid personal identity. These allow them to form relationships with others that are not based on the dynamic of savior and victim, but rather on affection, equality, and freedom, in which the body are no longer subject to torment or self-harm. Thank you.
Thank you, Doctor. We're now down to our last presenter, Dr. Alessandro Mazzetta.
So, good afternoon to dear colleagues. First of all, I would like to thank the PPA and the WFP for this wonderful meeting. For several decades, there has been a significant upheaval within nosography and psychiatric culture. According to some author, the term schizophrenia should be abolished as it is considered too stigmatizing. In August 2002, the Japanese Society of Psychiatry and Neurology proposed replacing the term schizophrenia with integration dysregulation syndrome. A similar process began in Hong Kong. In 2012, South Korea approved the adoption of the term attunement disorder. In 2016, Nirvanos published an article titled "Schizophrenia Does Not Exist," proposing the alternative term silent dysregulation, the removal of schizophrenia types from the latest version of the DSM-5 may perhaps reflect a similar direction. We question whether this will advance our understanding. Certain diagnostic terms illuminate the hidden reality of the illnesses, resonating immediately with clinicians and creating a precise correspondence between sound and object. We believe it is crucial to provide a accurate diagnosis without fearing that patients will feel condemned. This requires assigning the right name to each phenomenon. In psychiatry, to avoid a simplistic focus on behavior, it is essential to reclaim the knowledge and the language of psychopathology. In 1971, German psychiatrist Wolfgang Blankenburg published The Loss of Natural Common Sense. In this work, Blankenburg examined what is essential, the core in a polysymptomatic form of schizophrenia, such as simplex and schizophrenic types. He presents the clinical case of Anne Rau, a 20 years old woman hospitalized after an apparently motiveless suicide attempt the day before she was due to start a new job. Her experience was marked by a sense of existence looping aimlessly, timelessly, and unnaturally forced to fill the void, characterized by artificiality and bizarreness. Both the onset and the course suggest a simplex form of schizophrenia. Let us listen to Anne's account in her own words. What am I really missing? Something small, something strange, something important, something essential to live. At home, with my mother, I wasn't really there. I wasn't enough. I was just there, simply occupying the space without being present. I need a bond to guide me without everything artificial. Now, I always have to be careful not to lose everything. I simply feel I still need support. I need support for the most basic daily tasks. I am still too small, small in the way I think. I cannot stop thinking. Without a doubt, I lack natural common sense. Blankenburg comments, the loss of natural common sense must not serve as a specific symptom. Rather, it should act as a guiding thread for studying the metamorphosis of the human design, the being in the world, metamorphosis that undoubtedly reveal a precise direction. The psychiatrist breaks reality in its everyday immediacy, following Husserl's idea of epoche, suspending judgment to grasp the patient's intentionality, which is the intentionality of consciousness. Here, we emphasize the focus on the patient's conscious intentionality. Blankenburg attempts to enter the unsuspended world, expanded the so-called horizon of meaning through her words. He identifies 4 domains where changes reflect the essence of schizophrenia, captured at its origin before the emergence of delusions or hallucinations. 1. The relationship with the world, the perplexity with which the patient perceives it. 2. A temporal dimension, feeling of suspended temporality. 3. Sense of the self. Weakness, withdrawal, hyper-reflexivity. 4. Relationship with others, loss of the natural common sense. Anne admits feeling perpetually unhorsed by others, natural common sense, overwhelmed by something they possess, but she lacks. After electroshock therapy and neuroleptics, psychotherapy worsened her condition, bringing intense anxiety and a resurgence of suicidal ideation. Despite efforts to understand Anna's world, she tragically took her life the day before coming back to work. The author writes, following a change of therapies due to circumstances, and ungrowing belief that no fundamental change had occurred, suicidal tendencies came starkly to the fore. In the early 1968, Anne ended her life during a moment of unsupervised freedom, shortly before beginning a new job, as had occurred during her initial suicide attempt. Between the lines, we read an admission of resignation. Blanco reflects. From the perspective of developmental psychology and biology, cases like this suggest that such insufficient autonomy was already performed during early childhood, undoubtedly influenced by biological conditions. For Blankenburg, suicide represents an extreme attempt to impose boundaries on a suspended, timeless design. In the same year, 1971, the Italian psychiatrist Massimo Fagioli wrote That Instinct and Knowledge, published the following year. Its first chapter concludes with a case history detailing a psychotherapeutic approach to a patient who suffered from schizophrenia. Before starting psychotherapy, symptoms were characterized by severe depersonalization with alteration to arms and legs, total inability to work, social withdrawal, and auditory hallucination. Fagioli described the clash between the two opposing worlds, the omnipotent inner world of the patient, convinced of the immutability of his condition, and the third world, attentive to both conscious and especially not conscious communications. Fagioli writes, his internal fantasized reality was that the child inside him should not live, and the analyst opposed this. It was a fight between his internal, radical, absolute fantasized world and the analyst's knowledge and interpretations. On one hand, the patient suppressed any internal realization of self at the end of each session, convinced unconsciously of inevitable destruction by others. One dream. There is a woman who killed her child, so he is not killed by others. Then he shoots and kills some people. Then again, he has to kill his father. On the other hand, the psychiatrist present, through interpretation and understanding, reconstruct the dynamics underlying the illness. The patient's psychosis onset is linked to his father's death, and earlier to separation from him occurred during adolescence. The psychiatrist interpreted the subtle fantasy as an annulment pulsion currently directed towards the therapies, but previously against the reference parental figures. The annulment pulsion is recognized as the underlying cause of the patient pathology. Fagioli writes, the unconscious omnipotent annulment pulsion leads to 1. Internal hollowness and darkness. 2. The negation and disappearance of the self, because the external object is the projection of an internal condition of self, in identification with the father. The annulment of the identification with his father ruptures relationships, leading the loss of affectivity and virality, resulting in a state of emotional detachment and inability to relate. Fagioli's intentionality to heal as a non-conscious dimension allows the reconstruction of the illness history and the therapeutic relationship, uncovering the hidden content behind behavior. The reaction to the father's death and the foundational identification loss, culminating in a inner realization of emptiness and total destructiveness of the self. During therapy, the patient reenacts the annulment pulsion upon suspending of sessions, attempting suicide by jumping out of a window in order to break his legs. The suicide attempts fail and the therapy resumes. Thus, the patient cannot understand why the therapist continues the analysis. Fagioli interprets the repetition of the annulment pulsion made during the suspension of therapy, corresponding exactly to the same time of therapy when the patient had separated from his father, despite this having been interpreted to him multiple times before. The patient makes the therapist disappear by repeating the annulment pulsion against the father who abandoned him, attempting to kill himself in relation to the psychiatrist and previously himself in relation to the father. Furthermore, the therapist pushed forward to interpret the childhood cries of annulment at the time of weaning, as we listen, as evidenced by the patient's intentionality to break his own legs and the delusion of ruin concerning legs, altered into autoplastic depersonalization. Moreover, the therapist identifies the belief in incurability of the patient itself, tied to their inner thought of not being born, to be inside the womb, stemming from the disappearing fantasy directed against the human world and the patient's internal birth in relation to it. Over years of continuous work, the patient's omnipotence cracks, enabling a reawakening to this birth image, affectivity, and sexuality, to dreams. It was like a lake. A woman was swimming there. Someone pours milk into it, which diffuses in the water. I had sexual intercourse with a woman, but did not get up afterward. I stayed there. In conclusion, Fagioli argues that psychotherapists should recover and move beyond the clinical manifestation of psychosis, such as the loss of natural common sense. He understands and interprets the loss of the conscious vitality and the birth image in the non-conscious relationship with the patient. This non-conscious dimension of vitality and birth in others naturally abhors those who have lost them, like an erau, after once possessing them. Fagioli proposes a possibility to healing mental illnesses grounded in the breakthrough concept of a physiology of the non-conscious mind. According to this approach, mental illnesses is no longer considered a design, not a way of being in the world, nor a destiny, even in the most severe cases like schizophrenia. The author opens the possibility of actively intervening against immobility and the failure of another life. The human mind can fall ill in relationship with others during the first months of life, losing the natural common sense and the profound sense of one's own humanity. Hence, psychotherapy for Fagioli consists in helping the patient recover himself in order to be as being in relation with others. Thank you.
Thank you. We will now call upon Dr. Vanessa Maniego, our discussant, for his remarks.
Thank you very much. So first, I would just like to congratulate and express my gratitude to our four presenters for their very insightful and rich presentations on the human birth theory. And of course, thank you for crossing the oceans and joining us all the way here to the Philippines to join us in our convention and share your expertise with us. So I have to admit that when I was invited to serve as a reactor to this session, it was actually the first time that I came across the subject of the human birth theory. And it was also my first time to come across terms like pulsion and annulment pulsion, bombarding stimuli, which I came across in my own readings, or even disappearance fantasy. But I think it's always a valuable thing to consider other viewpoints of the existing theories, because it gives us a more comprehensive understanding and a broader perspective of how earlier unconscious processes influence human behavior in later life. So I think everybody will agree that there are quite a number of points that I think are worthwhile unpacking. But because of the limitation of my time as a discussant, I just want to share some reflections on certain aspects of what we have listened to in this session. The most important of which, I think, is something basic. I was reflecting on the similarities and differences between doing psychotherapy from the human birth theory perspective, in contrast to psychodynamic psychotherapy in general, which is the basic focus of most, or if not all, the psychiatry residency training programs. So while both psychotherapeutic approaches share some common grounds, such as their focus on the unconscious processes and early experiences, the human birth theory approach seems to be more focused on the birth process itself in particular, specifically the trauma of being born, as well as the experience of early dependency. So these are considered to be the foundational psychological events in the human birth theory, and they are central to the formation of the overall personality and even potential psychopathologies that may develop in later life. So another difference that I thought about was that in psychodynamic psychotherapy, it examines the broader range of the developmental stages. So it may also look into the influence of the caregivers, the attachment patterns of the developing infant, as well as the internalized conflicts that may take place over time. Again, in contrast to the human birth theory, which places particular emphasis on the birth process. Now, with regard to therapeutic focus, on one hand, psychodynamic psychotherapy broadly addresses the unconscious processes and how they manifest in relationships or life patterns or symptoms, whereas the human birth theory may focus more on primal experiences, such as the experience of or feeling vulnerable and dependent that is related to birth itself. So it may examine how these experiences influence the current behaviors, the relational patterns, or even anxieties of the therapy patient. Now, with regard to the interpretation of annulment pulsion, as discussed by Professor Giorgini, so basically I'm just looking at the phenomenon of annulment pulsion as a defense mechanism. Meaning, I think we can think of it as a psychological drive to undo, quote unquote, or get rid of the feelings of helplessness and vulnerability that are deeply rooted in the experience of being born. We have heard that from the human birth theory perspective, being born is a profoundly traumatic event because the infant is suddenly thrusted from the safety of the womb into a world that is overwhelming and filled with new sensations and threats. So for me, when we interpret the annulment pulsion, it is very similar to interpreting a defense mechanism to the patient, which can help both the therapist and the patient to address how the patient is attempting to resolve an inner conflict. So again, in my own personal readings, I found it interesting that Dr. Massimo Fagioli himself, he would work through the annulment pulsion that the patient is manifesting towards him as the therapist, specifically during times of separation. So for example, at the end of a psychotherapy session, or when he is going on a holiday break. So those are things that he would discuss with the patient. He also said that this plays a critical role in understanding the dynamics of whatever the patient is feeling at that particular time, whether it's guilt or shame, or whether the patient would engage in a compulsive behavior or rituals as a result of that. So another thing that struck me in doing psychotherapy from the human birth theory paradigm is that aside from taking into consideration the patient's dynamics, it also equally highlights the importance of the role of the therapist as possessing the ability to interpret a non-impulsion, but in a humane and compassionate manner, which I think should be a basic component of any psychotherapeutic framework or intervention. So this was highlighted in Professor Moneglia's talk on borderline personality disorder, that the interpretation should encompass the analyst's humanity, attention, understanding, and caring for the patient, which was described as a non-annulling relationship. Because in this way, if the patient is able to increasingly integrate such qualities, he or she can move towards self-compassion and eventually develop a renewed interest in others, which is where and when group psychotherapy may also take place. So finally, notwithstanding the valuable perspectives that the human birth theory offers, I would also like to pose some points for reflection and further consideration. Firstly, I was wondering how the human birth theory can actually be integrated with the current findings, specifically regarding the brain development and consciousness in neonates. So I know Professor Polese showed that one study on the preterm infants' communication with the mothers and fathers in the neonatal ICU. But I was wondering whether there are more empirical studies that focuses on the brain development and consciousness among the neonates in particular, considering that this is a period that's just right after birth. So secondly, I was also curious about the further influence of the intrauterine environment over the psyche. So for instance, the pre-birth sensory experiences of the fetus, or even the prenatal bonding between the fetus and the mother. So how might those affect the annulment pulsion, the impact of the bombardment stimuli, as well as the disappearance fantasy of the newborn? And lastly, I was thinking, how do we reconcile the universality of these phenomena? So again, we are looking at these as universal phenomena, the annulment pulsion, disappearance fantasy, and others. How do we reconcile them with the diverse cultural structures, and social structures? Because these can also shape the newborn's experience. So yeah, I think I would just leave it with those few points to ponder on, which maybe can also be included in future discourses on the topic. Thank you very much.
Thank you to all our presenters for their enlightening lectures. We now open the floor for questions during our open forum, and we only have time for one question. Our tech team will hand over the camera, so whoever raises his hand first gets to ask the question. Yes, doctor.
The way I understand it, because this is the first time that I have come across the term, annulment pulsion is a way by which a person deals with frustrating or disappointing reality. Is this something that is inherent in everyone, or is this brought about by certain characteristics in the person himself, which will make him resort unconsciously to this kind? And my second question, if I might be allowed to.
Yes.
Because in the role of the psychotherapist in this theory is to frustrate systematically the annulment pulsion. How is this done?
I think Dr. Giorgini will answer that question.
thank you very much for your question. It's not easy to reply, but yes, an online passion is something that is in all humans, and is a reaction that we have first at the birth, as Dr. Polese told us, but it's different because in that case we have another element, that is vitality, that can do this reaction, that can try to, that born us to, as all human beings have this kind of reaction. Maybe our discussant before René told us that how we can say that this kind of universality, this reaction are universal for all. We can see, for example, in dreams, because everybody talk different languages, but dream language is for all, it's the same. Also, because also in dreams we have no language, we have no words, we have images, and images have a kind of universality that is for everybody of us. And it's the same in art. When you look at an artistic representation, is the same if it's made by a Filipino painter or by a Spanish. And I think that we can say how to explain this in short term, that we can show when, for example, you told me, you asked me how to can frustrate this dominant passion. I try to reply in my paper that is proposing a different relationship, because if the relationship with the parents or the caregiver went wrong, is because there was a disappointing relationship. And so we had to propose a different relationship where we can see in the unconscious mind, and propose that see it's possible, see in the unconscious mind. And if the patient told me that I am as his father, I have to say that it's not true, because maybe I'm worse, but I'm not the same as him.
Thank you. Unfortunately, we have no more time for any further questions. That was a very beautiful session, which started with a discussion on annulment pulsion in psychotherapy, followed by the neurobiological basis of the human birth theory, and then the implications of human birth therapy in treating borderline personality disorders and psychosis. I would like to thank everybody for your engaging questions and active participation in our open forum. As we conclude this session, I hope to see you all in the next sessions. Please remember, you can check the schedule of the convention by scanning the QR code at the back of your IDs for the e-souvenir. We will now take a 15-minute break, and the next session will start promptly at 4:30 p.m., which is the case competition. Case conference. May I call on the presenters for a photo op to the front?